Welcome to the regular meeting of the Public Health and Safety Committee for May 1st, 2024. My name is Jason Chavez, and I'm the chair of this committee. At this time, I will ask the clerk to call the roll so we can verify the presence of a quorum.
Councilmember Payne.
Present.
Rainville.
Present.
Ellison.
Here.
Palmisano.
Present.
Vice Chair Wansley.
Present.
Chair Chavez.
Present.
There are 6 members present.
Let the record reflect that we have a quorum. With that, the agenda for today's meeting is before us. There are 5 items on today's consent agenda. Item number 1 is authorizing a joint powers agreement with Hennepin County for provision of social worker services. Item number 2 is accepting a grant from the Office of Justice Programs in support of the cadet program within the Minneapolis Police Department. Item number 3 is a grant from the Office of Justice Programs in support of 4 community service officers within MPD. Item number 4 is authorizing an agreement with Idea Analytics to collaborate on the Smart Policing Initiative Grant Program. Item number 5 is accepting a grant from the Minnesota Department of Public Safety for youth intervention programming. Are there any discussions on these items? Council President Payne, and then we have Councilmember Rainville.
Thank you, Chair Chavez. I was wondering if anybody from MPD could speak on the training for item number 2, and I was just curious about whether or not that training is kind of standard or is responsive to the settlement agreement.
If we have folks from MPD that could help answer Council President Payne's question.
And maybe to restate that question, is this something that is responsive to the settlement agreement or would be a typical type of training independent of any item response?
Council President and Chair of the committee, just for clarification, is this in regards to the OJP?
Correct.
Okay. Is this specific to the cadet?
I was just curious, is just from like a curriculum perspective, is this any training that would be like mandated by the settlement agreement or just standard cadet training?
Follow you, Chair and Council President. The training is, in short, training that's required for anyone who is going to be a peace officer in the state of Minnesota.
Got it.
Typically called the skills program. So there are 2 different pathways, at least within the Minneapolis Police Department. Several different pathways, but the 2 at question today would be a cadet program or a community service officer program. The cadet program typically are individuals who have a 2-year degree or a 4-year degree, and within the state of Minnesota you have to have a 2-year degree to be a law enforcement officer. So what the program does is puts them through, if they already have their degree, puts them through what's a skills licensing program that's required by the state. And once they're licensed through the state, almost like a state police academy, I guess is the best way to understand it. Mm-hmm. Once they've completed that curriculum, then they're able to be licensed if they pass the police test, which is the post test it's commonly known as. And then they're able to be licensed once they're hired. How it works in Minnesota is if you've passed the post test, your license isn't activated until you're hired by an actual law enforcement agency. So what's taking place with these grants is we're requesting the approval because we get monies reimbursed to us for, with the cadets, it'll be 2 cadets. With the CSOs, community service officers, it'll be 4 for them attending this schooling and this training, and then the monies would be given back to the state or given back to the city.
So these are, I'm assuming, folks who had already completed their education, whether they were interested in being police officers or not, they have that degree, but they need to take this additional training, and we would be paying for this, but for this grant, which is reimbursing it.
That's correct. And then there are two sides to this, 2 different pathways. So some have paid for their degrees already, and they're looking for a career change, and they get into the law enforcement. There are others with our community service officers who have finished high school, and they're looking to go to college, which we typically would pay for their college. And this way, we get reimbursed for the payment of those who are community service officers by going to school and paying for their schooling and their state skills program. And then, of course, they'd be hired by the Minneapolis Police Department.
Got it. Thank you.
Yes.
Thank you, Assistant Chief Gators and Blackwell. I'll pass it on to Vice Chair Wansley. Oh, just kidding. Councilmember Rainville.
Thank you, Chair. I just have a question on 5, the grant for the Minnesota Department of Public Safety, OJP. Is there someone that can speak to the type of strategies for inspiring youth in early intervention programs?
Do we have anybody from the Office of Community Safety or the Neighborhood Safety Department with us today? If you can, yes, please.
Good afternoon. Katie Miller. I'm kind of with Director Luana Nelson Brown being out. They asked for me to come in case there was questions. Unfortunately, I'm not well versed in the program itself. I don't oversee the contract. I just know it's been an ongoing component within the department for several years, and it's in partnership with Tubman. And so it's a cohort of youth that have progressive engagement with the staff over at Tubman. I don't know if that's helpful or not.
No, that's very helpful. Thank you.
Okay, thank you.
And Councilmember Rainville, can you just repeat your question? I'll have our clerks just note that question down so we can get if you didn't get your full answer, I think that would be helpful for the committee.
Well, I'm just wondering what type of programs that this covers. I'm going to vote for this. I think it's great, but I'm curious because youth intervention is very necessary, very important, and I want to support it. I just want to know what I'm supporting. Thank you.
Thank you, Councilmember Rainville. I'll pass it on to Vice Chair Wansley, and just want to clarify that our clerks got the question. I got it repeated, so you can have that. Thank you.
Thank you, Chair Chavez. I actually had a follow-up question on this piece and wanted to know if the programming or this grant will fall under our YGVI activities, if that staff member can come forward and provide a response.
Thank you, Katie.
As far as I'm aware, no, it does not fall under the YGVI. It's a separate program.
Okay, so who within NSD would be managing, like what pillar does this fall under since we do have GVI, YGVI?
Right. That is something Director Nelson Brown would have to answer. I'm sorry.
So I will name, thank you, Katie.
Yeah.
I would like to pull this separately for a vote. I'm actually going to motion to move this without recommendation in light of us also moving contracts from the AO committee, also tied to NSD. We also motion for those to be moved forward without recommendation, considering there are lots of concerns that we're dealing with within the department, and we do have a meeting with the mayor for tomorrow to discuss some of those that hopefully will provide clarity on many of the grants and contracts that's going through NSD. So I do want a motion for this one to be a separate vote.
We will have a separate vote on that item. Going back to item 1 through 4, I'm going to check the.
Sorry. I still have one.
You still have comments on items 1 through 4 or item number 5?
For 2.
Yeah, so like I said, we're going to go back to items 1 through 4. We are going to have a separate vote on item number 5. We're still back on item 1 through 4. Councilmember Vice Chair Wansley, you want to speak on item 1 through 4?
Yes.
Okay, Vice Chair.
Thank you, Chair Chavez. I also had a question related to item number 3. Sorry, actually item number 4, the Smart Policing Initiative Grant Program. Staff, thank you. Just wanted some clarity on this one. So the RCA says that Ideal Analytics will provide pro bono support to craft the application for this grant. So basically, are they providing grant application support?
Yeah, so council member, excuse me, president, chair, basically they're doing pro bono work of about 40 hours, and then they do that work and they do all the research for it, help write the grant, submit the grant. If we're awarded the grant, we still have to come back here for authorization for it, and then that's the point where we would come up with an agreement to pay them back for their pro bono work they did. If we don't receive the grant, then we don't receive any, or we don't have to pay any money.
Oh, okay. Awesome. Thank you.
Thank you, Councilmember.
Thank you, and I had reached out to city staff, and thank you, Assistant Chief Blackwell, for answering my questions ahead of the committee meeting. It says it was $1. Our staff couldn't put in that it was no cost to the city, so I don't know if that matters, but when you look at this on LIMS, they were supposed to put that it cost them $1, but it's actually $0. It's no cost to the city, but they weren't allowed to put any other number, so they had to put something down. So I'm not sure if that really matters, but I just wanted to note it so our clerks can help with that ahead of the full council meeting. Cool. So on items 1 through 4, since nobody else is on queue, I'm going to ask the clerk to call the roll.
-3.
-3.
Yeah. Remember, I want to motion that separately.
That's 5.
I thought it was 5.
Oh, sorry. Thank
Yeah.
you.
No, we're good.
Sorry.
Yeah. So yeah. Yep. So 1 through 4.
Councilmember Payne,
Aye.
Rainville,
Aye.
Ellison,
Aye.
Palmisano,
Aye.
Vice Chair Wansley, Chair Chavez.
Aye.
There are 6 ayes.
And then item number 5, Vice Chair Wansley made a motion to move this forward to full council without recommendation.
Second.
There's a second. Any discussion? Cool. I'll ask the clerk to call the roll.
Councilmember Payne,
Aye.
Rainville,
Aye.
Ellison,
Aye.
Palmisano,
Aye.
Vice Chair Wansley,
Aye.
Chair Chavez.
Aye.
There are 6 ayes.
That item has been moved to full council without recommendation. Our consent agenda is finished. Discussions items now. The next item is receiving and filing a presentation from Kelly Matter and John Tribbett from Avivo on the status of low barrier shelters. And we have the president and CEO, Kelly, going to start the presentation. And then we also have John, who works at Avivo as well. And we might, if we need help setting up the presentation, but I know that it should be up there, I think.
It is. And do you have it on your screens as well?
Yeah.
Excellent.
Thank you. Welcome.
Chair Chavez and City Council members, I'm Kelly Matter, President and CEO of Avivo, and I have John Tribbett with me, Service Area Director in our Ending Homelessness team. I want to first express our gratitude for the support that you have provided Avivo and others in our community fighting are working diligently and hard to end homelessness across our state. So we'll talk specifically, about Avivo Village and what we're facing and, where we're seeking input, ideas, and support as well. So for those of you who don't know Avivo's history prior to Avivo Village, we've been around since 1960 serving the community. We specialize in serving individuals with the most significant barriers to success, years of trauma, housing insecurity, substance use and opioid use disorder, serious mental illness, physical and other health challenges. We serve about 11,000 people every year, primarily in the Twin Cities, but a significant and growing presence in the central Minnesota region as well, where we are adding an Avivo Village in St. Cloud, hopefully over this next year, as well as their unsheltered homeless population continues to grow. So just a little bit about our impact. In the year ending in 2023, we served about 10,000 people. 99% of who we serve live at or below the federal poverty guideline, which is $30,000 annually for a family of 4. We are also the state's largest provider of MFIP services in 8 counties and helped about 1,100 families move off of public assistance permanently, and we continue to serve those families long term to continue to grow their income. 62% of who we serve identify as BIPOC, and 54% of our staff do as well. And we served about 2,500 individuals in our substance use treatment programming last year. What we're seeing, and I'm going to let John talk more about this as well, but we've been doing this work at Chicago and Franklin Avenue, starting in 1960 as a substance use and mental health provider. But we've not seen in 60 years of doing this work what we are seeing and have seen in the last couple of years with the acuity of addiction, the acuity of mental health, the unsheltered homeless crisis in our community at a time when all of us that do this work are struggling to find a workforce to do this hard work as well. So the acuity of needs is unprecedented. And I'm going to let John just talk more about that and how that impacts our work at Avivo Village.
Sure.
My name is John Tribbett. I'm a service area director at Avivo, and in that role, I help to oversee a variety of programs, including our emergency services teams, which is our street outreach team that works primarily, but not exclusively, in South Minneapolis, Avivo Village, a number of site-based, high-fidelity harm reduction, housing first buildings, as well as scattered site programs. And I think, first I wanted to say thank you again for having us here. It means a lot to just understand that you all understand there's a problem out there. And there's a lot of things that we're really facing. And I think when we go back to the inception of Avivo Village, it was created, it was an emergency because we had all these extreme crisis situations occurring in our community. We had COVID, we had the murder of George Floyd, we had the subsequent civil unrest that followed in the wake of it. We saw lots of people outside that, frankly, we knew in the work that they were there all along, but they were now forced to be visible. And the second wave of the heroin epidemic, or the opioid epidemic, was in full force. I will say that we repeatedly say to ourselves, we wish we could go back 3 or 4 years, because as bad as it was then, it has gotten much worse. The comorbidities, the amount of people dying from overdose deaths on the street, all throughout our community at all levels of income, has gotten to be extreme. We are seeing more and more physical and health impacts. We're seeing more elders. We're seeing more people who have acute comorbidities around mental health issues, as well as chemical and substance use disorder issues, particularly opioid use disorders. And, really that has created, we were grateful that we have the opportunity to do the work in the way that we've been able to do at Avivo Village, but it has driven into us day after day after day how important it is to have a place in our community that's willing to welcome people in that are still caught up in the grips of substance use disorder and are frankly not able to potentially enter other shelter systems. And those are the people that we walk into the community to try to find and bring inside. But it's a challenge.
I'll walk quickly through this, but as John said, there are days when we wish we could go back to 2020, but at the time in 2020, and and all things that John said, Avivo stepped up. And it was our honor to step up and work with our community and open really a trauma-informed, first of its kind in the country, indoor tiny home shelter, collaborating with individuals experiencing unsheltered homelessness, the many, many advocates that were working in the community, and all levels of government at the time. Because all of us were working against the clock, if you will, as it relates to COVID dollars and getting those dollars spent, we were against a really tight timeline, and finding a facility that would host this innovative design for indoor tiny shelter was difficult. And there was one building and one building only, and honestly, it was perfect. It had high ceilings, it was wide open, it allowed us to do this. But it is an old building with old infrastructure, and the cost, the lease for this space is extremely high. I was going to use the word exorbitant. I'll just say extremely high. So, and then it's just been compounded by all of the things that John talked about. So, I'm going to go fast through some of this. How many of you have been to Avivo Village in the North Loop? So most everyone. So you have a picture on the screen, but it looks very similar as it did. It's been well cared for, though we've had over 500 individuals who were sleeping outside come through Avivo Village. We've helped almost 200 people. Are we at 200 yet?
Yes.
So we've helped.
Yes.
I didn't mean to steal John's thunder, but we've helped 200 people move into permanent supportive housing, and we have reversed over 200 overdoses. So virtually keeping people alive at Avivo Village. The next slide is a picture. So we've gotten lots of support, and we do a lot of fundraising as well as develop many, many community partnerships. And I think this is just a fun one. We partner with Mission Animal Hospital and Street Dogs, and they've done a veterinary clinic with us and will continue to do so. And this also helps people be ready to move into permanent housing because their pets that they love and care for get their shots and their everything they need to move into apartment. So I talked about Avivo's successes overall. I'm going to let John talk a bit about Avivo Village successes and outcome.
Sure. And we have a colleague that we work very closely with that's the director of the shelter, and he says something very salient oftentimes, which is that getting access to treatment, recovery, and getting off the street has to be as easy as it is to get high in our city. Unfortunately, it costs about $2 to purchase the lower end of fentanyl in our community. And so we have to make things highly, highly accessible. And so I just want to give you a quick anecdote story of an individual that recently came into our shelter. It's a 22-year-old Native American woman who had been most recently outside for a little over a year and a half. Prior to that, she had been in a youth program. That youth program did not work out for her for really two big factors. One is she was also a victim of domestic violence, and her abuser was accessing or coming close to the facility and the property in a way that made her continue to feel threatened. And also her substance use disorder, her opioid use disorder, got in the way of her ability to actually stay in that facility, and so she was back on the street. Our street outreach team began interacting with her. She revealed to them that she was 2 months pregnant, and we were able to get that woman into our facility about 2 or 3 weeks ago. Since arriving, she's completed a comprehensive assessment, which is the gateway to either getting into a treatment program or medically assisted treatment. She's now on Suboxone. We're not in the clear, but we are way, way different than we were 4 weeks ago with that human being. And to that point, within the Vivo Village, I won't read all these stats to you, but we've had 18 babies born. Now, we don't have babies in the facility, but what it means is we are directly, again, addressing high acuities in ways that 3-4 years ago didn't exist. We didn't see young mothers that were pregnant on the street over and over and over again. Unfortunately, today, it's a regular occurrence. And so that is just a story about how we do that work. The other thing is really just when we talk about harm reduction and high fidelity harm reduction at Avivo, what we really mean we're encapsulating the principles of the National Harm Reduction Coalition. And those principles don't deny that drug use causes real, in not every case, but in some cases causes very real and detrimental damage to human beings. And so we want to be eyes wide open about the fact that that is a feature of our community. And until that is not a feature of our community, we need to treat those people with dignity, curiosity. We need to be radically welcome to them, and we need to make sure that they have a safe place to come into from the streets. And so we are really committed to the full continuum of supports, and that can mean everything from what's going to keep you from procuring or transmitting a potential disease, all the way up to full-blown abstinence-based recovery within our own continuum of support at Avivo, but also working with the community. We have countless providers, county, city, private nonprofits coming in. So, turn it back over.
Thanks, John. Go to the next slide. So as I said, as we continue to learn and grow and lean into curiosity and welcome all members into Avivo Village, we're at a pivotal point as it relates to the facility and the significant public dollars that have been dedicated to Avivo Village in the North Loop. They are, as I won't read aloud from the slide, but we are funneling many dollars into a long-term lease that will end in 2030, and we'll have spent about $10 million on a lease without a future for Avivo Village. So, we're here to share this. We're here also seeking ideas that you may have. We're looking for a strategic intervention so that these public funds are best used and go primarily to the people that need the services and the people providing the services. But it's putting, this project and these services, in a really difficult spot. So we are looking at one possibility of securing the building. If we could purchase the building and it could remain in service to the community of people sleeping outside, that would be one approach that we're thinking of, and something we want to present to you all as a way that we could potentially work together. I won't read aloud from this as well, but I think that is one of our biggest expenses next to staffing. Staffing costs have raised, as have the cost of running a high fidelity harm reduction 24/365, 24/7 facility. We did just submit a proposal to the city of Minneapolis and got some good news this morning around some energy efficiency outcomes that we hope will reduce some of our operating costs, but we would like to reduce some of those costs even further. Another key thing about this project is that we are warmly welcomed in the North Loop neighborhood. We have great engagement from businesses, the North Loop Neighborhood Association. We have a business owner that volunteers every Tuesday with our residents to pick up trash over a 3-block area, and that's been occurring for well over a year. So it's a good location for the services for the individuals we're serving and for the entire neighborhood. We want to recognize, we appreciate the opportunity you've given to us today, but we also want to recognize that Avivo is not alone in this need. John and I met with David Hewitt from Hennepin County on Monday of this week around the fiscal cliff that is occurring for many of us doing this work at the end of 2025 when the ARPA or the COVID dollars that we have been using to do innovative initiatives that have an impact are going to end. And that is part of why we're here now, trying to get ahead of that. And I'm sure you and others are hearing from other organizations. And their challenges are just as real as the challenges that Avivo is facing. So we are seeking support. We're seeking ideas and a way to work collectively across all systems, county, state, city jurisdictions to continue to address these complex needs that have grown more complex since we opened in 2020 for individuals that are experiencing unsheltered homelessness, high acuity with substance use, opioid use disorder, mental illness, and many other comorbidities with major health concerns. And the other thing that we see is that there's really no other place for people to go. We are serving people that probably, that a transitional housing shelter is not the best space, but many times it's the only space. And our team rises to the occasion and continues to be honored to serve everyone that comes to us that has no place else to sleep or stay. So a comprehensive analysis of the financial impact is yet to be fully realized. I also recognize that there's not a full-blown return on investment study of a shelter like Avivo Village. We are fundraising as we speak to partner with an organization that will do a longitudinal kind of long-term ROI study on a model such as this. But we also recognize with that it is still cheaper for individuals to sleep at Avivo Village than it is to use our emergency departments, that it is to use our jails, and that it is to live in an encampment that will be moved as well. So while we are seeking a full-blown return on investment, we know that the ROI is there when we are moving over 200 people into permanent housing, many people into jobs, many people into substance use treatment, and getting those types of outcomes. I feel like I don't want to read. So with that, we are here just to utter our deep commitment to collaborating with you, with all public, private, not-for-profit entities to continue to work towards ending homelessness in Minnesota. We are absolutely committed to the dignity of every human being, and we do need input, ideas, and support to continue to do so. Thank you.
Thank you, Kelly and John. We have a few folks on queue, so first I'll start with Councilmember Palmisano.
Thank you, Mr. Chair. Thank you for this presentation, Ms. Matter, and thank you for coming and really having that. In the spirit of collaboration, I think it's really important to note what you said earlier, which is there are $0 in this committed past 2025. So that's really important for us to hear, for the public to understand as we look at what's next and how we collaborate going forward. There isn't a lot of information on costs and revenues here. Can you help me understand how much your operations cost per year?
Yeah, so let's see, I'm just going to look at the right number. So the total cost is approximately $5 million, for a year, and that includes the intensive services, the shelter operations, about $550,000 for the lease and the property taxes and the insurance that is being paid to the landlord.
And it's serving how many individuals at a time?
100 individuals at a time. So there's 100 individual tiny units.
Right.
Mhm.
Right. So thank you. I mean, I think it's just an important number to $5 million, I think.
No, sorry. The number of people annually.
Oh, right. The capacity is 100, but how?
Since we opened in December of 2020 with 8 people, and while we continued to build it out, we've served about 525 people.
Right. Thank you. Yeah.
And we have seen, just on that note, we have seen the length of stay at Avivo Village to creep up, coinciding with what we're seeing around opioid use disorder.
Thanks.
Vice Chair Wansley.
Thank you, Chair Chavez. Actually, Councilmember Palmisano raised questions around some of the financial, outlook. And you mentioned the financial cliff specifically, and wanted to see if you could expound upon that, of what that concretely looks. I can't recall if you're saying you would start at zero without those ARPA dollars, or yeah.
Yeah, I don't think we'll start at zero. It's hard to predict. So we do get funding from the state of Minnesota. We know there will be grants for shelters from the state of Minnesota long term. We get about $1.8 million right now in state funding for Avivo Village. So we could probably predict something similar, but it's not certain.
Right. And then also, can you share how much the building costs in terms of opportunities to purchase that building?
So we pay about $550,000 per year for those costs that I mentioned. I mean, I think the cost of the building, right now is $10 million to purchase it, is what we've been told. I don't know if there's opportunity to, because that's an owner looking at the life of the lease, and it's $10 million, and so the purchase price is $10 million. There may be opportunity for a different number.
Yeah. No, this is really good context to know, considering, one of our authorities here as council members is around allocating resources. And I know we've done this in the past in terms of allocating $1 million, thanks to Councilmember Chavez leadership last fall, to attempt to support you all in the expansion of, a Vivo site, hopefully in South Minneapolis. And it just brings to mind that, at least on the council or the city side, it's really not a matter of like a lack of resources. While you were speaking, I ended up going through some of our LIMS files to look at, our practice of encampment enclosures, which has shown to be ineffective in actually providing long-term or even short-term support to our unsheltered residents. City staff, in their report on those encampment closures, share that it costs about $40,000 and $60,000 for each encampment closure. And then going back to a legislative directive that I co-author as well, I believe with Council President Payne, on opioid responses, and acknowledging that the city also has not shown up in the most effective way in being responsive to this crisis that has taken hold of our city, and especially our young people and young residents of color. And seeing in their presentation that in our opioid settlement fund, at least as of February 29th, we had $2 million there. So again, just knowing the totality that we've expended on encampment enclosures, also couple that with the resources that we have with the opioid settlements that we're going to keep getting revenue from, we should be able to support you all post 2025 in sustaining this instrumental site, as well as expanding, because I think everyone recognized we do need, need additional sites of Avivo villages across our city. So I am really looking forward to and knowing that Council Vice President, who chairs the Budget Committee, Aisha Chuktai, sent out an email today, letting us all know it's time to submit your budget priorities, and they're going to be doing something different in terms of like seeking our input first before we talk to the mayor about what our priorities are. And I really would like to see this be a top priority of the city using the resources that we have at our disposal to show up as a strong financial partner in supporting this work that we know is necessary. And unfortunately, it's going to be in a financially precarious position in the near immediate future, and we can intervene in that right now. So I look forward to working with my colleagues on this committee, as unsheltered homelessness is a priority of this committee's body, and really looking at how we can prioritize this in our budget deliberations. So thank you.
Thank you, Vice Chair Wansley. Thank you.
Councilmember Ellison.
Thank you, Chair Chavez. First, thank you all for the presentation. This is good information for us to have. It's good for us to have it on public broadcast so people can see it and have access to it as well. You alluded to this earlier, but you guys are kind of up here existing as a microcosm for what's happening more broadly, right? Which is, I would say, not just a precarious financial situation, but kind of an existential crisis in how we approach this work in the future. And I think people really need to understand that, it's several programs, like a dozen programs that could end at the end of this cliff, at the end of 2025, which is coming up really soon. If we feel like we're barely sort of plugging the hole when it comes to, opioid addiction and encampments and things like that, I mean, what's going to happen when those programs end, right? We're talking about hundreds, if not 1,000 plus people hitting the street all at once. And so I really appreciate you guys being here to sort of highlight that. And, I also, just want to say, this, as I'm listening, I'm trying to think about how the city, where the city fits in, right? And I think there's plenty of spaces for us to fit in, but especially when it comes to the building needs, right? City doesn't often put a lot of money towards operations, but we put money towards buildings. We put money towards build out. We put money towards infrastructure like that. And so just, I'm taking that in and trying to figure out how we can support in that way. I want to say, you talked about you named at least 3 levels of government, if not 4, right? Local, like city, county, state, federal. I think that it is going to take probably a level of intergovernmental partnership that can often elude us in order to solve this problem. My cynical self says that, like, if everyone is satisfied with where they can kind of point the finger, then nothing's going to happen, right? But if all of us are sort of, understanding the level of this problem and understand the severity and the timeline, I think that's the thing that I, really am trying to harp down is the timeline. Then I'm hopeful that we can start to address this problem. When it comes to that $5 million a year, you guys might not have numbers on this now, but like, I know often when it comes to Avivo Villages, cost comes up as like, okay, we love this model, but it's an expensive model. Do you all kind of have any sense of the cost when it comes to not doing it this way, right? People in gymnasiums on bunk beds, sort of shoulder to shoulder, no pets, no belongings. Do we know, how much longer does someone stay on the street? How much more likely are they to end up in ER or jail? How much less likely are they to get into permanent housing? Because, when I hear you guys talk about that, I think some folks think, yeah, it's a great model, but it's an expensive model. For me, I'm like, is this just what it really costs? And we've been shortchanging this our approach for that long. And I don't have numbers to that, but that's what comes to mind when I'm hearing you guys talk about both the results that you're getting and almost having to couple that with a cost that at its face might seem like a negative or a drawback, but maybe we shouldn't think of it that way. Maybe it's just kind of the cost of doing this well. So I don't know if you have any response to any of that, but.
Yeah, and I'll let John respond as well. I mean, I do think we need to look at what is the cost of emergency department visits. What are the costs of 200 people dying outside? What are the costs of 18 babies, dying? What is the cost of having people in our jails? I mean, I think there's an old number that it's $139 a day to be in jail, and it's very similar cost to Aviva Village. And we're getting outcomes of permanent housing, training, recovery. It is the deep service-rich model that, some people might say it's an expensive model, but if you look at it, longitudinally, which we do aim to do, it's not expensive at all. And I want to talk about that.
Yeah, it's a good question, and it's a vexing question to us because these are oftentimes numbers that don't show up on a spreadsheet because you can't quantify a set group of people and track them. There have been studies that have been done. Some of them are old, some of them are new. A lot of them will put it in the tens of thousands of dollars per year at a minimum, and some of them are much at the higher end of that. Again, we think about crimes related to homelessness and people just ending up incarcerated. We think about the cost of someone coming in. For instance, we had a gentleman that came in not long ago that was at risk of having both legs amputated. And at this point in time, things look okay. He's not totally out of it yet. But again, what does it cost? Obviously, there's a human cost, the humanity cost, which is what we are most obviously focused on. And we also recognize there's a taxpayer cost related to these things. And so what does it cost if someone has to go into an extended stay to have that major of a surgery? Sometimes these wounds are they can be related as a byproduct of the poisoning of the drug supply with things like xylazine, but oftentimes they're a product of people having frostbite in the winter. And every single summer we're working with someone who's losing a leg, losing a hand, losing a foot. So those come with not only the human cost, but the financial cost. And I think when we think about the disparity piece, we know that Native Americans in Minnesota and persons of color generally, but in particularly when we look at that community and the impacts of the people that are outside, we know that they're 10 times more likely if you're indigenous to die of a drug overdose than if you're a white Minnesotan. At Avivo Village, we are leaning directly into those disparities. So of the 200 people housed, over 54% of those people identify as Native American. So we are really deliberate. We're not trying to claim that we're something we're not. We're not a culturally based organization, but we open up space to try to work with the community in a way that seems to be working for them. And so there are also those costs around those historical legacies and the racist systems that have perpetrated people staying in poverty. And so, how do you quantify that? That's a hard number.
Well, absolutely. And thank you both for this and for, again, sort of standing in almost as a proxy. I know that's not what you signed up for, but for this larger issue. And, if anybody else is concerned about, that wants to see more people in recovery, less people in encampments, that wants to support people, on their road into as somebody who's housed and healthy and in a dignified and secure situation. This is kind of your signal to get engaged and talk to the state, talk to the county, talk to us about how you want us partnering to make sure that we don't fall off this cliff at the end of 2025. So again, thank you all.
Thank you.
Councilmember Rainville.
Thank you, Mr. Chair. I represent the North Loop, and I want the whole world to know how much the neighbors support you. Because, your program, whether to pick up the trash or there's always going to be something, but you address it quickly. And every time I speak to people in the neighborhood, they speak so well of your effort. So you are right.
Thank you so much.
And I kind of did a rough number on the $5 million a year over 4 years, helping 500 people. It's a little under $40,000 a person. But to me, that does not seem too much. Not at all, because it works. You've proven yourself it works. So, and I don't expect an answer today, but I'd love to talk to you further offline and continuously. It seems like we have to get better cooperation from, for sure, the county and state as far as funding. We can do what we can do, of course, and we will. I think I'm looking at the dais and I see willingness in everybody's eyes. But my mystery is the federal government. It would seem to me that the federal government could be more helpful for you to secure these, to buy the facilities, and then to help you with the ongoing funding. So you've been very gracious with your time today, but if you could contact my office, please, 673-2203, and we could talk offline, because I'd like to learn more about how I could help.
Thank you.
Thank you, we will.
Thank you.
I think Councilmember Ellison has something that from the previous
Yeah,
conversation.
just wanted to add, Councilmember Rainville is an awesome partner to share a border with, but I believe this block is in Ward 5, so I just wanted to clarify. I'm messing with you, Michael.
We're not at, it's not Plymouth Avenue there, it's 10th?
I think this block up to MPHA, I think, is Ward 5.
Okay, great. Thank you for telling me that.
Do you still want to talk? No.
Y'all share the border.
I'm not
Depending
going
on
to
where
take
we
back my
park.
kind words, however, or my willingness to help.
Council President Payne.
Thank you, Chair Chavez. I think the fiscal cliff is a really important thing for us to plan for, and I'm really glad that you're here speaking early about it so that none of us are going to be surprised. I think it's also important for all of us to recognize or find where that line is between, pandemics are hopefully a once-in-a-lifetime occurrence, and this intersection of the pandemic and the fentanyl crisis seems to be like a hopefully once in several lifetimes confluence. But we have to start thinking sustainably about, we had a one-time pandemic, so we got one-time funding, and it's actually really helping to close some of those gaps. But how do we think about what aspects of the challenges are we facing that are one-time challenges that we're going to get through versus just ongoing sustainable or sustained challenges that we need to solve for? And so I'm thinking about that a lot, not just from a, if I could just say the thing out loud, a direct ask of this body to do ongoing funding, right, as one potential solution to close that gap. But also, we do know that there's funding at the federal level for this through HUD and the continuum of care. There's potential funding sources from Medicaid and whether or not we're getting people assessed and enrolled. And I'm just curious, when you think about that sustainable source of funding, what kind of existing funding streams are there, that whether it's continuum of care in HUD, Medicaid, and other sources of funding? Because what I'm trying to ultimately get to is what's our roadmap, not just from having the political will to prioritize these investments with our resources. As vast as the city is, they are limited. But how can we go and advocate at the county? How can we go and advocate at the state and with our federal partners to make sure that either the existing programs that they have, if it's costing and I did the same math and it came out to $40,000. If it costs $40,000 and we can actually point to numbers that say we have babies being born healthy, we have people getting sober, we have people in permanent housing, we should be paying that $40,000 all day, every time, and it shouldn't be a question, and it shouldn't be a fight, and it shouldn't be about political will. It should just be about the allocation. And also the reality is that a local government, the scale of dollars that we have relative to the federal government is just going to be different. And so a thing I'm thinking about is not just whipping votes for the budget cycle, but also what conversations do I need to have with our partners at the county, at the state, and the federal government. So boiling all that down, what are the existing funding streams that are that kind of sustainable per person source of funding? And then what do you think might be an opportunity as far as filling in those gaps? Is it going and talking to Representative Omar about the continuum of care and how much it funds per person, or is it talking to, Senator Dietzick or Representative Jordan in my ward about, UCare and Medicaid? And I'm just curious if there's any kind of simplified answer to that, although I know that will be a bigger, more complex conversation.
Yeah, I don't think there's a simple answer to it, and I do want to just state again, we aren't here for you to solve this problem. It is, one of awareness and kind of support in thinking about it and thinking ahead. I think Avivo and all organizations that do this work, whatever term you like, braided funding, patchwork quilt. Sometimes I joke that we fund Avivo Village through everything from bake sales to large, federal grants. So I think, at the federal level, there's federal dollars that flow to, the state, the county, the cities, and sometimes they go to projects like this. At the federal level, there are direct appropriations, and Representative Omar was gracious in funding an initiative we're part of on the north side, doing sustainable energy training. But generally, it's one time. Some of the large federal grants, it can be 5 years, which it feels like a gift. But there hasn't, and then the COC is, kind of it's a contained number. And so in order for a new program to get funded, it means another program gets less funding or no funding. So it's a kind of a zero-sum game unless if there's more dollars that come into our continuum of care in Hennepin, Ramsey, and other metro counties. I think rates are a huge issue when you talk about Medicaid. We've talked about treatment here. Avivo is a treatment provider at the at the Day on the Hill for treatment providers. Our state has had 40 treatment providers close their doors. So it's much easier to get fentanyl than it is treatment, and that is an issue of rates. So there does need to be advocacy for rate increases for treatment when we're, we haven't seen the top of the curve of the opioid crisis. And we need to change how we provide treatment to serve this population. So treatment providers are closing. Other organizations that, get, primarily funded through Medicaid, which Avivo is, are closing, and we barely hung on by our teeth last year. So rate increases would be significant in order to use Medicaid as a reliable funding source for deep, service enhanced programming like we do. So it's continued to be that braided funding. I think most of us that do this excel at it. And the challenges of the last 3 years, no matter how good we are at braiding funding, it just hasn't been enough. And then to lose the one-time funding is why we're here. So sorry,
that's actually super helpful. Okay. I mean, I like if I were to do one focused effort, talking about Medicaid reimbursement rates feels like something that would be very productive as we also think about how can the city, put some of our resources in, because we have a vested interest in making sure that our community is supported and safe. And I think that Avivo is helping us achieve those goals. And so, but, again, we want that sustainable per human level of funding. And these programs exist. But if the rates are just not enough to actually solve the challenge, then let's have that conversation. So I really appreciate that.
Thank you.
Yeah.
Yes, please.
So I would also just follow up on that and say it's not just the rate increases, it's the structure of the program so that they become workable. And while Minnesota was definitely out front, and we have the state people at the state to thank for that in getting those dollars to bring them into homelessness services, the reality is that the structures that were put in place when we actually got them on the ground, they just don't work. And so it's rate increases, and then it's ease of accessing those funds in ways that really work with people in the way that we need to. And again, there's just been pressures around, we have to pay people more money. There's less people working. There's competition from city, county, state, and federal government. And so even with our housing support rates, they've increased only marginally in over a decade, marginally, and the costs for people and paying people, and so that we have people, we want to be able to pay people so that they are not on the verge of entering the very programs we administer, and so we welcome any opportunity to be creative with that and to partner with that, and I know that MHFA is working to try to think about how they can be more creative. So,
thank you.
Thank you. I have a few questions. I want to start with big picture first. So there is a lot of our providers are going to be struggling in the coming years. Based on your conversations with our other partners that you all work with, what is the number one concern people have? And you come in today, obviously, with a lot of concerns of what the future of Avivo could look like. I want to start with the big picture of not only Avivo, but our other partners. What are people talking about? Mm-hmm.
We partner very closely with Beacon, for example, and other, as we move people into permanent supportive housing. They're just, there's not enough dollars for the services. Avivo is generally the service provider. The services are greatly needed to help people stay housed when they move into permanent supportive housing. The staffing costs have gone up, and then security costs. We've all added 24/7 security, and that's an expense that, you can't work into a budget you present to MHFA, if you will, for a permanent supportive housing. So it's the same thing, that we're facing.
And I would just add, in the shelter space, I mean, we are, again, that same, the word that I've heard to describe it is a sharp fiscal cliff, and that everyone is facing that, and really there is a collective element to this. Obviously, we're here because we want to keep our program operational, but the reality is if all these programs are not operating, then the pressure that will be put on any of the remainings will be just very, very, very high. And what I'm hearing is that there's concern about the ability for everyone to get those dollars, and some of the traditional non-governmental folks want to be more upstream with their funding efforts. And so, everyone is quite concerned about what's happening.
Mm-hmm.
Thank you. And then, so what happens to Avivo at the end of 2025 without any action from government partners, right? So let's just say there is maybe some dollars that you have that are private investments, but there is no, what happens?
I mean, honestly, we would need to close.
Okay.
We are committed to the model because it works. We aren't willing to not, the fidelity of the model. We need to maintain that, so we would need to close.
Okay, thank you. And then my last question, which is a really good for us to know as we're trying to, prioritize tackling unsheltered homelessness. There's around 200 plus people, around that number, 198, probably more after this presentation got submitted, of people that have been permanently housed. What do folks that get housed through this program, through Avivo Village, what do they say? Like, what gets them to the point where they're able to finally have safe and stable housing, which we know this program started in 2020, like, it is effective. It's not meant for everybody, right? But it is effective, and it is working for a lot of people. And I think, what are people saying? Why is this working?
Yeah, John, you talk all afternoon.
Yeah, I'll pick one, and I'll pick a recent one that happened yesterday, and I'll try not to have feelings showing. We had a gentleman that, frankly, we have been really, really, really struggling with, because there's a comorbidity going on with this individual between mental health issues and substance use disorder issues. And by struggling, we mean we need people. We're going to keep people in at every effort, but the reality is they also have to operate in a community, and sometimes that line gets too far into the impact of the community. Frankly, we've probably kept that person longer than in some ways we should have. Yesterday, he signed a lease, and he got into his apartment, and he said that he could never have imagined that the quality of the home that he actually moved into, and not every home that we're able to move people into is the best, but this was one of those opportunities. And he said, I never believed that I deserve, as a human being, deserve to have a place that was this nice and felt this safe. True story yesterday. Yeah.
Thank you. I don't see anybody else on queue. Kelly, John, just want to thank you for being here. We'll send some follow-ups just to have some meetings. I know that this is a big topic that's interesting to a lot of our community members. I know that Councilmember Rainville actually reached out as one of his priorities to talk about Avivo as well. So a lot of the committee members here have been talking about Avivo and figuring out ways we can support you all and ways to even expand. That's really important to addressing this crisis that we're in. So seeing no further questions or comments, I will direct the clerk to receive and file that report. Thank you.
Thank you all.
Thank you. We are so grateful for your commitment and your support and your listening.
The next item is receiving and filing a presentation on the Health Department Division of Environmental Health, Regulation, and Businesses that fall under various city and state health codes. Here to present on this item is Cindy, the Director of Environmental Health. Welcome, Cindy.
Thank you.
Are my slides showing? Okay, perfect. Whoops. Okay. Thank you. I'm Cindy Weckworth. I'm the Director of Environmental Health, and I'm delighted to be here today. I'm going to start at kind of the 5,000-foot level. I think it's always helpful to kind of understand the regulatory framework. I recognize it's just after lunch and it's legal law, so I promise it's only 3 slides, so just hang with me here. Our authority to license, inspect, and enforce the applicable laws in the city comes from our delegation agreements with 2 different agencies, the Minnesota Department of Health and the Minnesota Department of Agriculture. Under the delegation agreements, we're required to incorporate the relevant state statutes and rules into our local ordinances. And in most cases, we just adopt these by reference, and I'll show an example of that. It goes further to say that our ordinances may not conflict with or be less restrictive than the relevant state's rules and statutes. And in fact, Minnesota Department of Health says we can be more restrictive. Minnesota Department of Ag says we need to be lockstep. We can't be more or less restrictive. So the one example is the Minnesota Food Code. That's Minnesota Chapter 4626. And this is adopted by reference. So there's a lot of technical language and direction that's in the Minnesota Food Code, but you won't see that show up in our MCO. Our ordinance just says, look there and do what it says over there, essentially. Our programs are systematically evaluated by both of these state agencies to verify that we're following the articles of our delegation agreement. The Minnesota Department of Health delegation agreement, they just started a new model where they were continuously under review. We look at 2 standards every year, and it just continues to cycle through. And with Minnesota Department of Ag, they evaluate us every 3 to 5 years. We actually start that process in less than a month. And it's a really thorough, kind of fine-tooth comb process. They look at all of our ordinance language to make sure that it matches their language, and if there are any changes, we're required to make those changes. They review our policies and make sure that we're following the policies that we set. They review our standard operating procedures to make sure that we're following those. They review our reports and the way that we describe violations and verify that there are reasonable timeframes in there to fix these items. They make sure we're hitting our required frequency and how often we inspect. They shadow and evaluate our field staff. We have 20 field staff. Last time they went out with 14 of them. They verify that we're following up on complaints. They verify that we're investigating foodborne illnesses. And that's just the short list. It's quite a bit. And so we are gearing up for that. So more at the 500-foot level, my division's programming is often referred to as food, lodging, and pools, but this is definitely an oversimplification of the areas that we're responsible for. When you could break it down, you can see that there are many businesses and many nuances in each of these categories. So there's all of the different restaurants and bars and all the shapes and sizes they come in. Coffee shops, schools and daycares, the stadium and the convention center, food trucks, special events, and food vendors. And then there's the hotels and motels, board and lodging, and this includes the sororities and fraternities at the U. And then pools and spas. So this is all the municipal pools, such as the outdoor ones that are operated by the park board, as well as all the indoor and outdoor ones associated with apartment complexes, condominiums, hotels, things like that. And then our delegation agreement with the Minnesota Department of Agriculture delegates those duties to us for all the grocery stores, and this is all parts of the grocery store, convenience stores, which is both the corner stores and the gas stations, vending machines, food trucks, food vendors, farmers market, and cottage food vendors. And then in addition to that, we also have programs that we inspect under the city ordinances. And these include body art, which is the tattoo and piercing, tanning, laundry, dry cleaning, massage plan review, staple food, which addresses food deserts to make sure that there's healthy food available in all parts of the city. And then the green to go packaging, which verifies and makes sure that people are using packaging to go that is reduced or recyclable, reusable, or compostable. So we have three major guiding principles to protect public health through our inspections and enforcement programs at businesses that are regulated under the health code, to support our businesses, and we do this through education, consultation, training, and resources, and to be part of a city that works with, and this is by working with other departments, other stakeholders, and seeking continuous improvement in all of our programs. I have sprinkled in a few quotes from some of our operators into my slides. At the end of all of our inspections, we have a QR code that takes them to a customer service survey. And this operator says, "The inspector was extremely pleasant and helpful. She really made the process clear. She answered all of my questions with kindness and professionalism." Thank you. As I mentioned, protecting public health is the founding principle for us, and we have a number of tools in our toolbox, as you can see from the slide. We work very hard to influence change and gain compliance through education and consultation. And that's really where we focus our effort on every inspection and at every step. There are times, of course, when we do utilize our enforcement tools, whether it's issuing citations, a compliance hearing, or an emergency closure. For each of these items, we have standard operating procedures when progressing to that next level of enforcement. That does mean that when we work with our businesses, it's in an equitable manner and that we're transparent and consistent in our actions. Last year, in 2023, we conducted 6,843 routine inspections at a little over 4,500 licensed restaurants. Or not restaurants, these are all of our different licensed facilities. If any business has more than 9 points, it triggers a follow-up inspection. You can see from the pie chart that 80% of the businesses did not require a follow-up inspection, and 20% needed at least one additional follow-up inspection. When we're on inspections, we really zero in on the FDA's top 5 risk factors. These are risk factors that have been identified as being more likely to result in foodborne illness. These include food from unsafe sources. Sometimes we see meat that has been imported that hasn't been inspected, or uneviscerated fish. We might see home-prepared foods. Just in the last couple weeks, Trader Joe's had a recall of basil, the herb basil, due to salmonella. Last year, there was a recall of cantaloupe. 5 people died from that outbreak, and many, many were sick. And every year, we investigate multiple illnesses associated with shell stock, either from Vibrio or norovirus associated with raw oysters. We look at time and temperature. There is a danger zone between 41 degrees and 135 degrees, bless you, where bacteria exponentially grows, and there's also bacterial toxin growth in this area. So we want to make sure that foods are being held hot and cold properly, and also that food that's hot is moved quickly through the cooling, when it's being cooled, moves quickly through that danger zone. And then we also look at cooking temperatures, making sure that the temperatures that food is cooked to are adequate, especially with the proteins, to kill bacteria that might be associated with it, such as E. coli in hamburger and salmonella in chicken. And we look at personal hygiene. So, hand washing, glove use with ready-to-eat foods, properly changing their gloves, whether or not ill employees are working, and if they have their illness employee log. We've seen a real shift in the last 15, 20 years from outbreaks being associated with improperly cooking proteins to more the norovirus, where it's an oral fecal, poor hand washing type scenario. Not very pleasant to think about. And then we also look at work surfaces. Are they properly cleaning and sanitizing their stainless steel work surfaces, their cutting boards, and is there any cross-contamination that happens maybe between ready-to-eat food and raw proteins, or with allergens, which would be considered an adulteration? I mentioned that much of our work is focused on preventing foodborne illness. Last year, we responded to 142 complaints about foodborne illness at 195 establishments. When these actually do raise to the point of an outbreak, we work closely with our epidemiology team and with the Minnesota Department of Health. The CDC estimates that each year about 48 million people experience foodborne illness, 128,000 are hospitalized, and 3,000 deaths. And this little guy here, that's our norovirus guy, he's gone viral. This is another quote. The inspector was very helpful from a standpoint of explaining how to minimize risk of foodborne illness. So transitioning into some of the ways that we support our businesses. One way is to share information with them directly in newsletters. We have 13 different email groups that we send our newsletters to. The one that we send out most frequently, and both of these are associated with that, is our food business newsletter. It goes to almost 8,000 emails. And when we send it to all of the people in our email bank, it goes to about 10,000 emails. This is the landing page for our website. We have lots of resources online. In Minneapolis, approximately 80% of the businesses are independently owned. So they're chef-driven, mom and pop, maybe small corporations. This is in contrast to the suburbs, where 80% are corporate or chains. So in those situations, they have a corporation that creates all sorts of resources and training for them. And because of our statistics, we really try and step into that gap and to create those resources. All of our resources are available in English and Spanish, and then most of them are also in Somali, Hmong, and other languages. And you can see we have lots of videos also. They're actually recognized nationally. In fact, Minneapolis is recognized nationally for our food program and all of the resources that we have. I was invited to be part of a national panel at the National Environmental Health Association conference to speak specifically on the way that we work with and support our food businesses. And I ran into a woman who is the food director for, our food safety director for Safeway grocery stores in Washington, D.C., and she said, "Oh, you're from Minneapolis? I use your HACCP plans. They're the best ones out there." And we hear it all the time. So we've got a lot of really good work that goes into that. These are some of our resources that are online. The first three, the self-inspection checklist, the food temperature log, and the cooling log, are all available in 13 languages. The food safety videos are in 6 languages. Preventing Wasted Food, which just launched, is available in 3 languages. We have posters, the food safety posters and allergen materials that were developed just last year in English and Spanish. And we have an amazing group of health inspectors who speak 8 different languages. So that's a real benefit for the operators and the food workers in the establishments. These are a couple of examples of our one concept poster. Very visual, available in English and Spanish. It's one of my favorites. We also have a lot of online training. Historically, training has mostly been available to the food service manager, and we wanted to make sure that there was training available for the food workers, the line staff, if you will. So we have 4 online trainings available that are 3 of them are specific for food handling, and one is the new one that we just added is the one on allergens. And we have a voucher system, so anyone who owns or manages or works in a restaurant in Minneapolis can get a free voucher. Serving Safety is our on-site food safety training program. So this is a program where we actually contract with food safety consultants who provide both classroom and kitchen training to food service workers and managers, kind of like on-the-job training. They can have up to 8 visits, and we have seen when we look at their inspection reports before the training and after the training that there's an average of a 67% decrease in the number of violations. It's pretty staggering. These are offered this training is offered for businesses that are struggling to meet the food code requirements, and they're invited to participate in the program. And businesses can struggle for a number of reasons. It may be that they are a chef-driven restaurant and they have a lot going on and they're doing a lot of specialized processing and they just need some additional help and guidance. Or it might be that there's a language barrier or cultural differences and they need coaching to understand and implement the food code rules. We have a number of different ways we do classroom training, and we like to pivot and try and offer what it is people are asking for. We have a common problems training that's available in English and Spanish, and we host it several times a year and on request. We do special events training prior to some of the larger events that have lots of especially short-term vendors, such as for open streets. And then this last year, we provided multiple trainings at the Northside Economic Opportunity Center, NEON, supporting their food entrepreneurs by offering food safety and classes, and then also talking with them about different permitting opportunities. We've done a lot of training this last year on the street. We've done just-in-time training for street vendors who we've provided a letter to them that has rules and resources. We have a contract with LEDC specifically to help the food vendors on the street, and so we provide them with their contact information. We had training at a local church, St. Cyril and Dominus. Just last Friday, we did a training at Waite House. The last few Wednesdays, we've been doing training at the Career Force Food Shelf, and we've had training in our own city building. We also offer them the free vouchers for the trainings online in Spanish, and there's a food handler training and an allergen training that's available. We're working on planning cottage food training. We are developing a welcoming kit with thermometers, sanitizers, and test strips. And we've also, in these same spaces, been distributing civil rights, labor rights cards to let them know about sick and safe time, wage theft, and minimum wage. And we've also been in conversation with other community organizations and food shelves on other ways that we can show up to help provide information. A little bit more about our contract with LEDC, the Latino Economic Development Center. It's a $20,000 contract. We know, we were realistic about how much work we can do with $20,000, but we're really focusing on educating vendors and getting them permitted in an approved location with the equipment they need and helping them find commissary kitchens. And LEDC is kind of leading that effort with a lot of support from our staff. Another quote, the inspector gave us resources for training videos, which I will make all new hires watch and have current staff watch. I definitely feel comfortable asking him questions or advice in the future. And kind of our last tenet is to be part of a city that works. We believe in continuous improvement and that it's essential for us to continue to be a leading edge program. These are all newer initiatives that were either identified as part of our risk factor study or rose up organically from what we saw in the field. So in our risk factor study, we looked at all of the violations that we've written in the last couple of years. We focused on the FDA risk factors that might cause foodborne illness, and we really tailored it to those items. So we just released a hand washing video. It not only talks about the proper way to wash your hands, but it also talks about the major violations we see, which is blocking the hand sink and not properly stocking the hand sink. We have a foodborne illness video that helps managers and food workers understand the investigation process, make it less scary, and let them know why we ask the questions that we do. And we really emphasize that the goal is to try and break the disease transmission cycle. We created this shelf stock poster here that's on the slide. This is to help businesses understand what they need to do to meet the very specific requirements for shelf stocks. They need to date the tags when they're used. They need to keep the shelf stock tags with the product. And there's a certain amount of time after the product is used that they need to keep those tags before they can throw them away. We also, our allergen education campaign was a year-long campaign that really promoted sesame as a new major allergen that was added by the FDA at the beginning of last year. So we promoted that and then created a lot of materials for front of house, back of house, servers and managers, and provided them with tips on preparing and serving food to customers with food allergies. And the next one, the standard orders in plain language, the standard orders are written in a way that's kind of legalese, like clean and maintain clean, and it's hard to translate and it's not as easy to understand as just keep it clean. And so we've worked through about 130 standard orders to write those in plain language, and it also makes them easier to translate. For Green to Go, we no longer allow black plastic to be used in restaurants. Black plastic is essentially trash. It can't be recycled. And it actually had not been allowed in the curbside recycling for residents for a number of years. So we just we're enforcing that. We did a year-long campaign. We had 9 different newsletters go out last year, and so that started on January 1st. We also updated the body art ordinance and created a new inspection checklist. We're working on active managerial control training for the operators and managers. And then we've done a lot of work on website improvements and revamping our website to make it easier to use. And we're also collaborators. We work across divisions and across departments. Along with Homegrown Minneapolis and Child Girls Catering, we recently wrapped up filming for several videos and launched the Prevent Wasted Food website. This helps businesses reduce the amount of food that's thrown out and helps Food for People get to people. Hopefully, maybe you were able to attend the Public Health Hero Awards, and heard directly from Liz from Child Girls and our very own health inspector, Nick Kareen. We are working with the University of Minnesota on a restaurant policy and mental health study, and that's with the Division of Occupational Health and Safety. And we worked with a Michigan graduate student who was looking at priority 1 food violations. So those are ones that are more likely to cause foodborne illnesses. And then things that we do on behalf of others when we're out in the out inspecting. We hand out the labor rights business cards that I mentioned earlier for civil rights. There's also a sick and safe time poster that's required to be posted, and we make sure that's posted. We check the stickers on the hoods to make sure that they've been cleaned within 6 months, and if not, we alert fire inspection services. And we also check grease traps on behalf of Public Works, because otherwise it can clog up the sewers. We collaborate with lots of different organizations during large events. Obviously, the Big Ten men's and women's basketball tournament just happened, and now we're preparing for the U.S. Olympic team tryouts. I don't know if you are aware of this. I didn't know this until the Super Bowl. But the Federal Bureau of Investigation, the FBI, actually considers food a weapon of mass destruction. And that's because intentional contamination of food, or terrorism, can sicken an entire sports team, an entire police force, the media, whoever it's targeting. So we really have a strong piece of food defense in addition to food safety when we're working on these large events. And finally, just continuous improvement. Internally, we do a lot to make sure that we're working at a really high level. We do peer inspections every month. We are required to be standardized every 3 years. So we have 3 standards that get standardized by the state, and they come back and standardize all of our staff. We there's a program called, it's the FDA. It's a Voluntary National Retail Food Program Standards, and it's best practices. And so we are working towards meeting all of those best practices. We have monthly technical meetings so that if we see something new in the field, we can bring it back and understand, like, if it fits, if it falls into the code. Then we have QR codes for our customer service survey, which I mentioned earlier. So when you look at a couple of the responses there, when we asked how satisfied were you with the way the inspector explained problems to you, you can see that 98% were either very satisfied or satisfied. And there's another quote there. We learned something new from our health inspector. She takes great care to lay out what we need to fix and how we can fix it. She has taught us many things. She was an exceptional resource during our reopening after COVID shut down. She's an asset to your department. 5 stars for our health inspector. We love those kind of responses. We think it's a big deal, and that's the reason I bring it up, is we are a regulatory arm, and when we get that kind of feedback, when even in the midst of regulation, it says that we are going out with the right attitude and the right we really are from the government, and we're here to help you. And then this last pie chart, how satisfied are you with your health inspection? You can see here that 97% were very satisfied. Couple more quotes. The inspector is extremely thorough and offers instructive comments and solutions and is very personable and enthusiastic about helping us. And then a comment about how helpful it is to have health inspectors who speak more than one language. So here's my team. Many of them are here today. If you guys want to take a wave, okay. I apologize, we didn't have a chance to get an old picture. 3 of our newest team members are missing: Alejandro Campos, Lauren Bone, and Dalton Gillen, and we are working on getting a new picture. So thank you for your time, and I can answer any questions you may have.
Thank you for that presentation, Director Beckworth. That was helpful and informative. I'm going to check the queue if any of my colleagues, Council President Payne.
Thank you, Chair Chavez. I just wanted to say thank you. I think this is a body of work that oftentimes goes unnoticed, and the more unnoticed, the better, usually. And, you know, you raising the fact that the FBI sees this as like a weapon of mass destruction actually puts that into perspective in a really meaningful way. And so I just want to say thank you. And we've worked really great together, and I've just really appreciated all of your work and your entire team.
Thank you so much, Chair Chavez, Council President Payne. I appreciate those comments.
Councilmember Palmisano.
Thank you, Mr. Chair. I also just want to say, in conversing with small business owners pretty regularly, in my part of the city, we regularly also get compliments about your team. And I do wonder, and something just to kind of think about going forward, is I wonder how the environmental health team might also be leveraged in other initiatives and city values we have going on, like our zero waste efforts. And maybe that's something just kind of for future discussion. You're already doing quite a lot. I'm not trying to add to this plate, but I recognize that you're already there. You're already in these establishments and having very productive conversations. Also, this presentation, Councilmember Payne mentioned the weapons of mass destruction. It makes me even less likely that I'm ever going to eat oysters, though my husband loves it. That we have to keep these tags for audit purposes for months, lest there be an outbreak. So yeah, my husband likes those.
I like them steamed. Not so much raw. Thank you very much. I appreciate hearing that.
Thank you, Councilmember Palmisano. I also don't eat oysters. The texture of it is just not my thing.
Mine meld right here.
Yeah. Very helpful to hear about a lot of these. The website is translated in different languages. I think that is very helpful for a lot of the community members in our neighborhoods in Minneapolis. Question about the customer service. Customer service survey, is that in different languages too, or how can we get to that point?
It's in English and Spanish right now. It's just those 2 languages at this point.
For sure. And then how often do people fill out the survey? Like, do you know, like, how many people, how do we get more people to fill it out? Like, what are people saying? And besides just what you presented today? Yeah.
The data that I had here was about 50 responses. Cool. I know that we had more responses the year before. Normally people fill out the customer service surveys when they're unhappy. Yeah. So the fact that we have this many people who are, 97, 98% satisfied is pretty remarkable.
That's a good number.
Yeah, it's a very good number.
Thank you. You talked about the plastic ban, the black plastic ban. Can you talk to us about how the enforcement works? And I know it's kind of a new change, but yeah. Yeah,
it is a new change. We started talking about it in our newsletters on, oh my goodness, April 21st.
2 weeks ago.
Yeah, a year, what's the holiday? Earth Day. Yeah. Thank you. All I could think of was Silent Spring. On Earth Day in 2023, and so in that time frame, we had 9 newsletters go out letting people know that we were not going to allow the black plastic to continue to be used because it's just trash. It can't be recycled. and that, please use it up or see if you can return it if it's unopened. We looked at the very same containers are available clear and in white plastic, and those can be recycled and can be sorted. We always start new programs with, as informative. So we would write the violation and let them know, hey, just so you know, starting January 1st, you're no longer allowed to use the black plastics. So it wouldn't be until probably next year when we've kind of seen everybody throughout the time frame that we would start thinking about, follow-up inspection or at some point violation or citations.
Cool. Thank you. Then my last question, I just want to understand how these delegation agreements work. I know it's probably in accordance with state law, but very curious on how those come to be. Particularly, there was a lot of, I'm assuming, different state agreements for different licensures that you mentioned at the beginning of the presentation. Curious about the food vendor one and just how those come to be, and is it like the health department has negotiations with the state, or just curious about how those come to be?
Yeah, the delegation agreements are standard throughout the state. So all the cities and counties that are delegated all essentially sign the same delegation agreement. The only difference in some, so not in Minneapolis, but in other places that have manufactured home parks or recreational camping areas, they're delegated those duties as well. We have the food, lodging, and pools, essentially.
Thank you. I
Sure.
appreciate it. I don't see anybody else on queue. So seeing none, thank you so much, Director, for being here today and for giving us this presentation. I will direct the clerk to receive and file that report. The next item is item number 8, and I'm going to pass that on to Vice Chair Wansley.
Thank you, Chair Chavez. This item is the municipal child care public comments. We've been working with our policy and research staff as well as colleagues to explore initiatives at the local level that centers early education, as well as, again, early childhood, in ways that we can show up. So we wanted to make sure that we could create space for parents to share their experiences with our child care system, especially those residing here in Minneapolis. As we're doing this ongoing research, which I will name, we were supposed to have a presentation from our policy and research team today, but that presentation will happen on May 15th at PHS at 1:30, and that report is online. But I will take a gander in the chambers to see if there are parents. Okay, we do. So we will proceed. We do have some parents here. So we will proceed with the public comment period, in which you will have 2 minutes each to share your piece. And I'm really looking forward to hearing this and really exploring this further in this committee. And I want to make sure that each testifier, make sure you sign up after you're done with the clerks so that your information can be collected, not in like a suspect way. But, but with that, I invite our first testifier to come to the... Oh, okay. I will pass it to Chair Chavez.
Thank you, Vice Chair Wansley. And I just wanted to remind folks that the report was on a summary on the current state of child care in Minneapolis, including data on the price and accessibility for families, work conditions in the child care industry, and upcoming federal, state, and county programs serving Minneapolis families. So to please keep your comments to what I just mentioned. Thank you.
On child care.
Awesome. Please feel free to begin.
Thank you. Good afternoon. My name is Lindsay. I am a parent and a parent organizer with Take Action Minnesota. My family and I live in the Bancroft neighborhood, and I appreciate the committee making space for these public comments, especially thanks to Vice Chair Wansley for your leadership on municipal childcare, which I have experience with an ocean away from here. My child was born in Luxembourg, that tiny country in Western Europe, where there is a guaranteed childcare system. All my husband and I had to do, as paid parental leave was expiring in order to get childcare for our baby, was select the government-run center that made sense for us and our commute. And I will never forget the first day that I dropped off our chubby 6-month-old. into the arms of like a combined 100 years of childcare experience in that room and just watched Eve's eyes grow wide as she was absorbed into like the infant crash pad area with the busy books and the other kids. When I walked out of that building and the door shut behind me into my afternoon, I wept with relief that I was an ocean away from home and not alone in caring for my child, and that I had no stress in bringing this like joyful and enriching care into my baby's life. Flash forward 7 months, my family and I were moving back home to Minneapolis, and out of all of that, the stress of finding jobs, of not having permanent housing, of buying a car, all of our stuff was on a boat in the Atlantic. It was a heat wave. We were 2 jet-lagged parents dealing with a jet-lagged 1-year-old. Far and away, the most stressful thing was childcare. Once we crunched the numbers, determined that we had the privilege that it made even a little bit of financial sense for me to go back for work, and Eve needed full-time daycare, all of a sudden it was elbows out. We were thrust into a game of musical chairs that fails thousands of children across the city, and in intense competition with every family in like a 25-mile radius for limited childcare spaces. Myself, thousands of members of Take Action Minnesota believe that every child in this city deserves safe and joyful places to grow and develop. And so thank you for your leadership on the research. I would urge the research and the policy action to go as bold as possible and pursue municipal child care guarantees. Thank you very much for your time. Leader Johanna had to leave to pick up her kids from childcare.
Thank you so much, Lindsay, for sharing your experience. I do want to reiterate again, we'll have staff come and give a presentation on the report that Chair Chavez gave a little bit more background on May 15th. We'll also work with Chair Chavez to include a public comment as well for that report back out so people can have reactions to the findings of that report. And yeah, make sure that there's more space for parents to talk about this important topic that I think all of us was hoping to see the state move on, and does not seem to be the case anymore. So
this year, right now. But yes, thank you very much, Heard, and hopefully we will have the space to be back. Definitely look forward to the report.
Awesome. Well, thank you so much. With that, we can close the public comment period, and then I will pass it back to Chair Chavez.
Thank you. Seeing no one else is wishing to speak, I'll close the public comment. Are there any comments from committee members? Cool. Seeing none, I will direct the clerk to receive and file those comments. Seeing no further business before us, I will declare that meeting adjourned. This meeting adjourned.